So, this topic is about the role of neurotransmitters in mood disorders, for example, the serotonin and dopamine. Now, firstly, we define what are the neurotransmitters. Basically, these are the chemical messengers in the brain. It transmits the signals between the neuron, which are the nerve cells, regulate our mood, emotions, and the movement. So the key neurotransmitters in the mood is the serotonin, dopamine, neuronephrines. So each have different roles in the mood regulation. First we define the serotonin. The serotonin basically regulate the mood, appetite and the sleep. So low level of the serotonin can cause the depression and anxiety, target of many antidepressants like the SSRS, which target by the serotonin. Dopamine. Dopamine is basically the reward hormone. It's used for the motivations and the pleasure. So imbalance in the dopamine cause the depression, apathy, and the addictions. It have been role in the schizophrenia and the Parkinson's patients. Norepinephrine. For example, basically it is the stress response and having the alertness. It linked to the anxiety, depressions, and mainly affects the energy and the focus. So, what are the mood disorders? The mood disorders may be the depression, the anxiety disorders, maybe the bipolars, and prevalence cause the millions affected worldwide. It impact on the daily life activity. Now, the relationship between the serotonin and the depression. For example, the low serotonin links to the depression. So, SSRS boosts the serotonin level and it improves the needs and reduce the anxiety and the mood. Dopamines and motivation relations. For example, low dopamines having the lack of motivation. So, it has been role in the reward system and the addiction. So their imbalance causes may be by the genetics, the stress, the lifestyle, which may be the diet and the sleep, and such as the medications and the medical conditions. Now, what are the symptoms of the imbalance? There may be the mood swings, the anxiety, the depressions, change in sleep, and the appetites. What are the treatments and the approach? For example, medications such as the SSRS, SNRS, therapies like the CBT, lifestyle changes like the exercise, and the diet will have the best treatment approach for these hormonal changes. SSRS is basically the selective serotonin reuptake inhibitors. Basically, it boosts the serotonin levels. It has been common antidepressant like the Prozac and the Zolpidem. Therapy helps like the CBT, mindfulness effective, change brain the chemistry and improve the mood. Lifestyle fixes such as the exercise boost the serotonin and dopamines, sleep, diet impact our mood level. There is also a relationship between the exercise and the neurotransmitters. For example, increase the serotonin and the dopamine and it reduce the stress and improve the mood. Diet and the neurotransmitters, such as the omega 3 vitamins, help to avoid the processed foods, and excessive sugars can be helpful to balance these hormonal conditions. Stress impact like alter the neurotransmitters levels and lead to the mood issues and anxiety. So neurotransmitter testing can be done which can be limited used in the diagnosis and mainly used for the research purpose. So as a concluding marks, neurotransmitters balance key for the mood health. The treatments and the lifestyle changes help to manage the mood disorders. Thank you so much.